Great. Good evening, everyone, and thank you so much for joining us. Just want to let you know that over 130 people registered for this event, and they were registering while we were watching the movie. So this is it's just great. And we had people from as far away as Arizona joining us today. So I'm Bonnie Sorak, and I'm going to be the moderator of tonight's event. I'm going to ask for everyone's patience and grace as we navigate the logistics of and the technical issues of doing virtual events. Things don't always go as we plan, so bear with us as we need to ask for your grace as we try to get through all this. Tonight's event is in 3 parts. First, we asked everyone to watch the film Unbreathable, The Fight for Healthy Air. And hopefully most of you have done so. And if not, the half-hour movie will be available for you to watch through to tomorrow. And for those of you who did join us just now to watch the movie, sometimes it was hard to hear because it kind of cut out a little bit here and there. So if you want to rewatch something, it'll be available for you. Second, we'll have some presentations from our 3 panelists. During the panel discussion, you will only be able to see the presenters as they're speaking. And during this whole program, you will be muted. Following the presentations, we will open for discussion among the panelists, and you will have the opportunity to ask questions. Feel free to type your questions into the chat box at any point, and we're going to do our best to address all the questions that we can. So first, just want to say we're gathered tonight to recognize the life and legacy of the great and honorable Dr. Martin Luther King, Jr. I would like to open us with this quote that was taken from his 1967 Christmas sermon at the historic Ebenezer Baptist Church. It really boils down to this, that all life is interrelated. We are all caught in an inescapable network of mutuality, tied into a single garment of destiny. Whatever affects one directly affects all indirectly. Did you ever stop to think that you can't leave for your job in the morning without being dependent on most of the world? This is the way our universe is structured. This is its interrelated quality. We aren't going to have peace on earth until we recognize this basic fact of the interrelated nature of all reality. End quote. So to begin our introductions, I would start with myself by telling you a story about the interrelatedness of my life and how this event came to be tonight. Bear with me as it's a little bit of a journey. And it was truly a fever dream. So back in November, my whole family was struck with COVID-19. We're all fine now, but it was a little rough going there for a little while. So while I lay in bed, there was a lot swirling around in my mind. And as way of confession, I will tell you that despite my having led Columbia Jewish Congregation's Green Team for 12 years, we had regrettably disbanded about 2 years ago. And there was some guilt and remorse lingering there. No one had stepped up to take over my role when I moved on to another endeavor to represent our congregation on the Jewish Community Relations Council of the Jewish Federation of Howard County. While serving in that position, I was asked if I would serve on the Howard County Martin Luther King Jr. Holiday Commission. Professionally, I work for the as the Senior Outreach Coordinator for Interfaith Partners for the Chesapeake. I had recently helped with a project led by 2 wonderful volunteers from St. John the Evangelist Roman Catholic Church, their new Green Team, to restore a rain garden on the grounds of the Wild Lake Interfaith Center in Columbia. At that event, a young Latinx Boy Scout said he would like to do a similar project in order to earn his Eagle Scout rank. St. John's Church happens to also hold services at Oakland Mills Interfaith Center, where Columbia Jewish Congregation worships. Perhaps we could help the Scout to achieve his goal by doing the same thing at OMI. But we will need help, and we will need congregations at OMI to provide support. How do we begin to find those people while we are all stuck in COVID lockdown? At the same time, the MLK Holiday Commission was trying to figure out how we might provide meaningful opportunities during the day of service in a virtual world. So tonight is the culmination of all these needs swirling around in my feverish head. I emailed our first speaker, Rebecca Rehr, and asked if she might be available and if she could recommend a good film centered on environmental justice, and she connected me with the producers of Unbreathable. Who else could we have on the panel? Well, we need someone who can speak to what our communities of color are experiencing here in Howard County and in Baltimore City. So our next speaker came to mind, Willie Flowers, of course. And then during the COVID filming of the COVID-safe filming of the MLK celebration program, our chair, Tracy Williams, recommended Dr. Chesahna Kindred. So what brought you here today? Anyway, okay, so we're gonna move on to our speakers, and hold on, my slide, there we go. Sorry, I'm going to share my screen. And so, are you seeing my screen? Can someone give me yes? Okay, good, thank you. All right, so those are our sponsors here today, our friends that are helping us with today. Why is this not advancing? There we go. All right, so our speakers for today are Rebecca Rehr is the Director of Climate for Health at ecoAmerica. She also serves on the Maryland Public Health Association Advocacy Committee, the American Geophysical Union's GeoHealth Section Policy and Fundraising Committee, and volunteers with the DC Greens Produce Plus program. She has served on the Maryland Commission on the Environmental Justice and Sustainability Communities. She was the Environmental Health Fellow at the US EPA Office of Children's Health and Protection, a Program Associate for the Center on Community Engagement, Environmental Justice and Health at the University of Maryland, College Park, where she received her master's degree from the School of Public Health. Our next speaker is Willie Flowers. He is the Executive Director of the Park Heights Community Health Alliance, where he oversees the day-to-day operations of a community-based health justice organization. He founded the Baltimore Road Race in Park Heights, the Urban Oasis Food Justice Program, Growing Food Together CSA, Community Mindfulness, and is working to build Woke Rose, an incubator that markets cut flowers. Willie also worked as the Government Affairs Coordinator for LifeBridge Health, where he oversaw grassroots lobbying, community affairs, and political outreach for the system's 3 community hospitals. He currently serves as the president of the Howard County branch of the NAACP, spearheading their Civil Rights and Social Action Committee. Willie's degree in political science and government is from Troy University, from his beloved home state of Alabama. Dr. Chesahna Kindred is a board-certified dermatologist at Kindred Hair and Skin Center, serves as the chair of the National Medical Association Dermatology Division, is a global expert in traumatic hair loss and advanced dermatology. Dr. Kindred founded the Onyx Medical Society and is the chair of the National Medical Association Dermatology Division, where she leads initiatives that address the healthcare disparities within the clinical research performed, which is pivotal to adequately providing treatment in people of color. Dr. Kindred has contributed to multiple publications for organizations such as the American Dermatology Association. She created a digital series called Derma Myth, where she debunks popular myths heard throughout the dermatology industry from both patients and practitioners, which birthed her first self-published book titled Derma Myth, Breaking the Cycle of Skincare Myths. Her undergraduate work was done at the University of Southern California, where she earned both a Master's of Business and a Doctor of Medicine from the University of Cincinnati. She did her residency at Howard University Hospital, is a member of Celebration Church's Health and Wellness Ministry, and also on the African American Roundtable in Howard County. So I'm going to stop sharing my screen, and I'm going to turn, oops, where is it? Hold on, getting ahead of myself. Hold on. Sorry. Oh, I know, here it is, over here. All right, so I'm going to turn it over to Rebecca. Rebecca, take it away.
Thanks so much, Bonnie. It's truly a pleasure to be with everybody tonight, if not in person, then certainly in spirit and in strength. I am going to share my screen and cross all the fingers that it works. And it looks like it is. So thank you to the technology gods. Thanks again for inviting me to speak tonight. That movie is very meaningful to me, being from Baltimore and seeing the youth movement really take shape and be able to define their own futures and define what their environments look like. I now live in Washington, D.C. I am safe, and as our community is being overtaken to ensure our safety, but just so everyone knows, I'm good. But it is people's communities. It's not just the nation's capital, and it's kind of quite disruptive to just people trying to go to the grocery store. So I think people don't hear that side of the story all the time, but that's part of the injustices in our narrative, and in our narratives. And I think that's something we have to keep in mind. So in the spirit of community and Dr. King, I just want to thank you again for inviting me today to chat. And I, living in DC, now working at ecoAmerica, have taken, I used to do some state level work in Maryland on environmental health, and now I'm working on climate at the national level. So I'm going to take the time this evening to just do a brief history of environmental justice. I think the movie does a really great job talking about the history of the Clean Air Act, and sort of just align that with a brief history of environmental justice, and connect that to climate change and human health, and then hand it over to our other speakers to bring it home literally to Maryland and Baltimore. So just a little bit about Climate for Health and ecoAmerica. We work to build public support and political will for climate solutions in the US. And I work with health professionals and health institutions to do this. We have tons of more information and resources on our website, climateforhealth.org and ecoamerica.org. So I encourage you to check those out. They're free and available to you. And tonight, we're here to honor Dr. King, but we also are still mourning the loss of two great justice champions, John Lewis and my synagogue during high holiday services last year. We lost Justice Ruth Bader Ginsburg on Rosh Hashanah, and this part of the sermon as part of Rosh Hashanah services was about her holy chutzpah. And I think we all, in the spirit of tonight, need to get in some good trouble and have some holy chutzpah to do what is right. So just a reason and a grounding for why we're all here. I pulled this from a couple of different sources, and I think it's really important to think about environmental justice starting with the Civil Rights Act. I think a lot of people think about environmental justice starting in Warren County, North Carolina, when there was sort of the first official and nationally recognized protest about dumping there. But really, Title VI of the 1964 Civil Rights Act roots a lot of environmental justice work today. And so we should really think about environmental justice being grounded. And part of the reason this timeline is so important is because there's been this national reckoning over the last several months, and people are coming to these issues, racial inequity, racism, the racism rooted in our systems. People are coming, let alone environmental injustice, people are coming to these issues for the first time. And everyone needs to do their due diligence and understand where the movement has been, so we can effectively help support where the movement is going. And so sort of I'm using this phrase in the spirit a lot tonight, but I think in the spirit of the history of Dr. King, and we need to respect the history of the environmental justice movement and know where it's been so we can build where it's going. And so in 1968, the sanitation strike with Dr. King that's really the first, nationally well-organized strike, protest where there, recognition that Black and brown communities, low-income communities are being disproportionately impacted by environmental hazards, and they're not being treated fairly by the law when it comes to environmental hazards. And I actually learned quite a bit putting together this specific timeline. And that is that the Council on Environmental Quality in 1971 acknowledged the disproportionate impacts of pollution in St. Louis and Chicago. It's only a 300-page report, so you can breeze through it in your free time, and it's publicly available on the internet. But you can check it out, and there are studies from the early 70s, so 50 years ago. So when we talk about, it's a new movement, no, not really. And I think we need to acknowledge that history again. I also learned that there in 1993, it was the first state level environmental equity legislation in Arkansas. And to me, when we try to pass cumulative impact legislation, environmental justice legislation, it's like we can't be the first. We can't, it's not well accepted. Those aren't. It's been done. It was on the books in '93, and so I think again, just important to recognize that timeline. And then it was in 1994 through President Clinton's Executive Order 12898. Federally defining environmental justice as the fair treatment and meaningful involvement of all people, regardless of race, color, or national origin. That I think that's when, again, people start to understand that modern day environmental justice movement and where it's gone over the past 30 years. This year is the 30th anniversary of the 1991 People of Color Environmental Summit. And so I'm hoping to see some celebrations throughout the year for the 30th birthday, sort of the coming of age of environmental justice. So just planting a seed for maybe later in the year, a celebration of that convening. But sort of people are more familiar with the post 94 environmental justice work, and that it ebbs and flows because it's an executive order and not legislation with the administration in power. But that there was quite a bit of work, not just in the communities, but on the federal level for decades before that. And we really need to pay that work the respect that it deserves. And we don't want to repeat, we don't want to reinvent the wheel. We don't, we want to build. And so just taking that time to know that history so we can move forward. So what does that look like? When we throw, a lot of terms, I think people use them interchangeably when it's important to understand the nuance, the difference between equality, equity, and justice, and know what we're talking about when we're setting forth goals. Equality, kind of giving everybody the same, equity, giving people what they need to achieve the same, and then justice, making sure they don't need that step up, that the system is fair so that everybody has access. And for me, in my work, that's rooted in health, that's in the social determinants of health framework. The idea that it's not just the absence of disease that defines health, but it is all these other factors. Your zip code determines your life expectancy. That is because of all these other factors, and in particular, environmental factors. That 25% of global disease burden is attributable to environmental risks, and that can be air pollution, water pollution, soil, pesticides, but that quarter of global disease. So that's huge opportunity for prevention if we address that percentage. And how does that come into play today with COVID? There's been lots of studies now that show that living next to polluting facilities, which you're more likely to be if you are a low-income community or a person of color, then you are also more vulnerable to not just getting COVID-19, but having a much more severe case. Because you've been exposed to all this air pollution already. So lots of, really important connections between COVID and climate change and air pollution. And again, sort of thinking about that in a cycle of environmental health disparities. And I will, Bonnie, I'll share these slides with you so you can share them with everybody. So you can sort of tune back in if you're taking notes. But that, there's this cycle. And that again, when we think about environmental health disparities, I also want you to think about it in terms of opportunities. At each one of these levels, there's an opportunity to intervene, create change, break the cycle, and create opportunities, for everybody, so we can achieve, we can work towards the goal of your zip code not determining your life expectancy. And then here's a neat graphic provided by the Centers for Disease Control and Prevention that kind of has that same framework for climate change. That climate change is impacting our health now in a number of different ways. And so this is, just a graphic to show that, rising sea levels, air pollution, increasing reliance on greenhouse gases, extreme heat, really has these concrete and definable health outcomes. And that it is not, while climate change is impacting all of us, it impacts different populations differently. And so we have low-income children are more impacted, low-income communities, older adults, folks who rely on caregivers, and communities of color. And so this is another, as you can tell, I like infographics. This is another representation of the way that climate change is impacting communities differently. This is a fantastic graphic. You're not going to have a chance to digest it all right now, but from the Lancet countdown on climate change, this is from the US brief in 2019. And this walks you through the different impacts that a heat wave has on different folks, and that we can really understand the resilience measures that need to be put in place to protect different kinds of people from heat waves as we experience them more frequently. This is also true. Systemic racism plays into exacerbating these disparities through discriminatory practices like redlining that historically were legal. Now, not so much. But in reality, you can't just flip a neighborhood, overnight to say that it's desirable or not desirable. And you go from relegating folks, forcing folks to live in certain places that have less desirable green spaces, environment, polluting facilities, to now, that has decades long impacts that we're seeing play out, exacerbating climate impacts. And so we need to know that climate justice is racial justice, and the way to work to achieve climate justice, to achieve environmental justice, combat environmental injustice, is to be anti-racist and to actively work against the racist systems that are in place that disadvantage people of color. And just as the youth movement in the video put it, that the youth in the video put it, they want a voice in determining their own future. And, great, let's step aside and build a platform for them is all I can say. And, we really see that in climate change as well, that heat and air pollution are impacting birth outcomes, increasing a low birth weight, stillbirth, very tragic, and early preterm birth as well. And so climate change is really impacting kids, and again, climate solutions can rectify that. But the great thing is that the youth climate movement is really impacting the way people are understanding climate change and climate solutions. And the youth are doing a much better job centering health and centering equity, and promoting voices of color within the environmental movement, within the climate movement, much better today, I think, than previous generations. So just going to end, and I know that was super quick, but just going to end with, sign on to the U.S. call to action on climate health and equity. And I think Bonnie's going to go into a little bit, some more actions as well. So I'll skip my momentous slide because you'll hear about it later. But just that there are actions to take now. And I encourage you to do so because, we're not alone in our concern. When we work together, we can achieve justice. And by centering health and understanding the health impacts of environmental injustice and climate change, we can really motivate people to act. So thanks again for the invitation. Thank you to the memory of Dr. King and Mrs. King for all of their work. And I look forward to the other speakers in the discussion.
Great, thanks so much, Rebecca. Now we're going to turn it over to Willie Flowers and hear what he has to add to our conversation tonight. And just to remind you, if you have any questions that have come up from the movie or from what our speakers have said, go ahead and start putting them in the chat. That would be great.
Good evening. Good evening. Thanks, Bonnie and Rebecca. Thanks for your introduction. Did a good job of breaking down the history of this. I do want to add that I certainly acknowledge the life, legacy, strength of Dr. King. It just happens that Dr. King inspired Dr. Robert Bullard, who happens to be from my hometown. He's kind of the trailblazer in being the first person to call it environmental racism. And at the time when he used that term, the mainstream wasn't accepting of everything being racist. But as you have seen, his work set in place everything that she broke down in that presentation that led with his book called Dumping in Dixie. And it created a framework for kind of the neglect, not just of African Americans, but Southern spaces, because you had enough space to build anything, and then you would build them next to Black communities. And so it comes out in the film, and it really displays the extreme neglect about just insensitivity to human beings, period. And it's consistent with this country. But what's also consistent, as you see in the video, is the resiliency of the people. And most of this resiliency is not funded. And it's very unfortunate. And I think that's one piece that should be considered, because when you have a huge company who heaping this neglect on communities, the community is off balance, they can be bought off and all of this. But there's never the reality of any type of capacity building for communities. They have to do it on themselves. And everything that I've done in my career, not only have I been consistent with this fight for racial justice when it was not popular, but also for all the details that strike down and strike the heart of Black communities, because it really settles down to health. And as she mentioned earlier, it's the outliers of social determinants of health that determine how we live, grow, and fight. And what I do professionally, not only do you have to get into the details of the history and the details of the significant terms, but you also have to another piece to resiliency. You also have to get in the game and fight for yourself. I happen to work in Baltimore City, in one of the most neglected communities in Baltimore City called Park Heights, but I also live in Ellicott City, Maryland, in Howard County. And the reality of that is it sets the conversation about the tale of two cities. And as a runner, I've literally run to my office, which is about 20 miles. And I can see all the changes as I run along, more so when I run than when I drive a car, because you really get a feeling of the community. And it helps me to understand the disparity of and neglect of what happens in my community that I work in and the community I live in. And we must fight to bring all those together. The one significant thing about the video was that in every piece of it, when we had success, it meant that someone had the organizing skill to bring everybody together to see how we all fit into it. And that is what we should do each and every time. Again, the work that I've done in the city includes building a conversation about environmental and climate justice, but also making families understand the value of something as simple as food as a rallying point, because we use neglected urban land to grow food. We flipped it and did the same thing in Howard County. And the two things that are significant about and what I call neglect of communities is the information on how people get the information. The information out the way by which people get the information to be resilient. So it's on us. It's on us. And as the NAACP has a history of being on the front line of this. Our Environmental and Climate Justice Division is one of the most significant organizing points in our organization right now. And one thing that we focus on specifically is how to be at the grassroots level in this conversation about resiliency. Like I said, we've done it here in Howard County. And what we discovered already, just by trying to do something as simple as a community garden, is that the other outlets for gardening in Howard County, even though it's set up, the information about the details of how to do it on your own in the spaces that are set up for that are not released to the African American families. So those are types of details. Even with the superb setup and planned community at Howard County, there's neglect. So all these pieces are opportunities so that organizations like mine can be on the front line again to get the information to the people who have it. So those are kind of, I guess, the challenges. But in a nutshell, the reality that larger organizations, whether they are mainstream environmental justice organizations, whether they are corporations that influence those organizations, as we all know, if the grassroots is not funded to be resilient on their own, the challenge will continue to persist. And it's on us to sound the alarm, and that's why we're here.
Wow, Willie, thank you so much. You were very succinct, and great comments, and we'll come back, I'm sure, to some of the points that you made. All right, so now we're going to turn it over to Dr. Kindred. So take it away.
Hey, everyone, and Bonnie, thank you for having me. This has been an outstanding presentation. so far. And as she mentioned, you guys, I'm Dr. Chesahna Kindred, and I really want to just take 10 minutes or less to go over the health effects of air pollution, or really just the damage that we're causing to the earth itself. A lot of times we're told to think of environmental responsibility as doing something now to protect the future, doing something now so that our grandkids can enjoy trees and things like that. And I'm hoping that I can convince you that you want to do something now for now. You want to do something today for today, and not necessarily only seeing the benefits in the future. And when we look at air pollution, sanitary issues, etc., the thought is everyone's affected equally, but it's not the case. And I hope I'll convince you that Blacks carry the burden of disease when it comes to environmental irresponsible practices. So 3 reasons why a lot of times they say there's disparities. One is because of housing. And a lot of times they'll quote living near a polluted source, which is the case. And Rebecca already mentioned redlining, but there are studies with looking at patients who have Medicaid. So there's kind of a proxy for income level, types of neighborhoods the patients live in. In these studies, it shows in this one sector of Medicaid patients that the health disparities related to pollution in Blacks was worse than that in whites. So housing alone is definitely a component, but it wasn't enough to explain it. Another one is a low social position. Another way to say that is lack of power, lack of wealth, etc. There's plenty of studies showing women like me, educated, college degree, wealthy, etc. All those positive social protectors. I'm more likely to die if I have a kid than a white woman with a GED. So low social position does have a role, but it's not the only thing. And another thing we hear is that we're predisposed to disease, more likely to have diabetes, high blood pressure, strokes, etc. Well, medical studies show that if we account for that, right? We account for high blood pressure, we account for diabetes, Blacks are more likely to suffer morbidities than whites. And while we still have to address these 3 main causes or reasons for disparity, the underlying tone of all of it is the big fat R word, right? And that is racism. It's still there. And what I appreciate about this program is it's addressing that with environment, which usually in the mainstream aren't put together, which is one of the things I appreciate about this program. The EPA did a study, and they found that it was race, not poverty, that was the strongest predictor of exposure to small particles, which they refer to as PM2.5. Those are small pollutant particles. And it was race, not poverty. That was the strongest predictor. There's other predictors, but race was the greatest one. So let's take a look at what the CDC said about the causes of disease. So I literally just looked it up. What are the top reasons that kill Blacks? Number 1 is heart disease, common. We're aware of that, but it's also related to effects of air pollution. Leading cause of death in Blacks, next one is cancer. So is the effect of air pollution. Let's look at lung disease. That's an obvious one. And we're finding that air pollution, people that are more vulnerable to air pollution are more likely to die of COVID, let alone asthma, which is what we already think about, or lung cancer, if we want to combine 2 of these causes of death. Accidents are unrelated. Strokes, sometimes that's blood clots. I didn't want to make it too much of a stretch. A lot of times that stroke is related to heart disease, but then Alzheimer's. Under the effects of air pollution, we have dementia. So literally when we look at the diseases directly associated with air pollution, they line up pretty well with some of the leading causes of diseases in Blacks. But what we would like to do is say, well, there's heart disease, but that's because you're obese, you have hypertension, cancer, maybe, we like to blame everything else other than some of the things that we like to ignore. So look at how they just line up almost too nicely. health effects of how we're treating our environment. So in regards to how it affects us now. Our elderly are more likely to die early as a direct connection of air pollution. And it's several studies have shown this. Even worse, our kids they are dying, but also suffering more so from asthma and other breathing issues. So when kids are born, we think of like when kids are premature, they have to be in a ventilator because their lungs are still maturing. Even a full-term baby's lung is still maturing. Kids' lungs are still maturing well into elementary school. And they inhale more air pollution per pound than adults. So they're more vulnerable. So we have elderly affected, our kids affected, and Rehr affected. So I just hope I convince you guys that the whole saving the environment isn't just something that we're doing to help somebody, help some generation off in the future. We want to do things like that now because it's affected us now, and we just might not be able to see that direct connection. And it takes programs like this, right? It takes the efforts that Bonnie is doing in religious organizations to start to address it and open up our eyes. Okay, thank you guys.
Wow, that was wonderful, Dr. Kindred. Thank you so much. So now I'm going to turn it over to some questions that we did get in the chat. Just to start off right away, there was a question in here. I can't find it right now, but yes, the slides will be made available after today. We'll send a follow-up email to everyone and with the copy of the recording of this discussion as well. So that will be made available for everyone. Susie Feldman is asking all of the panelists, she'd love to hear about concrete actions to take toward environmental justice. So I do have some slides about that we'll go over in just a few minutes. So I'm going to come back to that, Susie. And then Marge had put in the question, what has been rolled back in terms of environmental protections in the last 4 years? What are the environmental hazards in housing that are causing so much asthma in Baltimore City? So I think Dr. Kindred kind of went over that last part of the question, but I think, Rebecca, if you want to talk about what some of the rollbacks, I know you said your answer was there was an article in the New York Times, but I don't know if you want to talk a little bit about that.
Yeah, and I think I mentioned that there's usually a pendulum, right, that swings depending on the administration that's in power. The pendulum swung pretty far over the last 4 years. I will say that. And there's been a lot of, I did type it to the panelists, but I'll put it into so that all the attendees can see it. There was a pretty comprehensive list of 100 rollbacks that the New York Times published. A couple that come to mind that are really important. So thankfully, first of all, there was a big exodus of employees, right? We lost a lot of the workforce because it just became unbearable. I think we also, thankfully, some of the key offices in the EPA, the Environmental Protection Agency, are still in place. The Office of Environmental Justice was moved. It was in the Office of Enforcement and Compliance, and now it's in the Office of Policy, if I'm not mistaken. Don't quote me. And there was some concern about that, but I think it was okay, and they're intact, and I think they'll be strengthened in the next 4 years. I think the Office of Children's Health Protection is a really important office in the EPA, because if you're setting regulations that protect kids, you're setting, because as Dr. Kindred pointed out, kids breathe more pollution per pound of body weight. They drink more pollution. They're just exposed to more pollution because their body is still developing. So if we're setting standards that protect kids, we're setting standards that protect everybody. So that office is really important. It had some heat over the last couple of years, and it's been lost some staff. And so hopefully they'll bolster that office as well. There was a really important executive order that came out. I think it was something like combating sex and race stereotyping. So it has this really great title. it was awful in implementation, because it basically said that you can't do racial cultural competency or racial sensitivity training in any of federal government office. First of all, I mean, the language is horrific, and it's the effect of that for EPA is that if you have people working within the EPA who are writing regulations and perhaps carry inherent biases that they're not aware of, and they're unwilling, they're not given the tools to recognize their own internalized racism, then they end up writing that into regulation. And you see the perpetuation of structural racism in regulatory action. And so it's critical that that the federal government provide cultural competency and racial sensitivity training so that that racism does not get perpetuated into regulation setting, not just in the laws, but in the enforcement and compliance. And so that was a really critical executive order that I think isn't always talked about in the context of EPA and environmental decision making, but I think it's really important to think about that. There's another really important rule, the censoring science rule, that dismantles the scientific integrity and the way that we value science in rulemaking and lawmaking. Again, hoping that gets turned, stricken quickly. And then the last one I'll mention is the EPA's cost benefit rule, which is how we measure. A lot of times in the health field, we want you to take the cost of inaction or the benefit of health, investing in health. And a lot of times that's preventative costs. So it's cost savings as opposed to a hard dollar amount that you're spending. And that's a little more nuanced and hard to wrap your head around. The cost benefit rule that was being put forward did not allow you to take those considerations into effect when writing the rule. So censoring science, cost benefit are really big deals right now in the sort of health and environment space. So those are just a couple that I'll mention, but there's a lot of resources out there about other rollbacks.
Thanks so much for that, Rebecca. That was great. So there is a message from Ms. Williams. Mr. Flowers, it sounds like you believe in a combination of policy change and programs to address systemic racism. You want to talk about that a little bit?
Without a doubt. But I don't think the policy change happens until you have a resilient grassroots movement. You don't even have to call it a movement, just a grassroots attention to the challenges that not only are impacting us, but can be triggered if the information to families and communities is not there. As a follow-up to the first question about what we can do, is just that. I mean, I don't think there is any resistance right now to gaining information from any government about the details of how to empower communities. So if you sound the alarm, it can't happen, particularly around this whole reality of breaking the silos to all of the social determinants of health that exists, because it's all the same. It's the same that if you don't have a good job, you don't have good housing. If you have bad housing, you're going to have asthma. If you have a challenged education system, challenged transportation, all of this, health breaks all those silos. And then with the advocacy around environmental and climate justice, yes. And when you do that, then the policies that I think are important, one being just funding outreach workers culturally competent outreach workers who can explain to communities what is happening, what has happening, and the history of what has happened. In Baltimore City, I think in the late 60s, they made it against the law to grow your own food and to have animals in your backyard for about almost 50 years. And what happened as a result of that, you get all these I call it food apartheid, but the popular term is food deserts. And you have people who don't have access at all to quality food and don't have the experience of the type of resiliency that comes with growing your own food, or even I won't say anything about the animals because I don't eat those, but having your own animals if you want them, you know. So this type of damage has long generational effects on families. And so that's, like I said, if we get nestled into what the grassroots needs, articulate a message to them so they can be inspired and see their fate, then the policies will come.
Excellent, excellent. Thank you, Willie. So I'm going to move ahead we're getting lots of questions about actions that people can take. So I'm going to move into the section of that. So I'm going to share my screen. Here we go. There we go. Are you seeing it? Anybody? Yes? Okay. All right, good. All right. So as I mentioned, I work for an organization called Interfaith Partners for the Chesapeake, and we work with congregations to focus on the problem of polluted stormwater runoff. But as we started at the top with what Dr. King said, everything's related. So what makes the air dirty makes the water dirty, makes the earth dirty. So we work with congregations that focuses on stormwater runoff. So there's many things that faith communities can do, just raising awareness by programs like this, taking actions with your congregation and at home, and then also working on advocacy and policy, raising the faith voice, the moral voice behind these things is something that's really, really important. So next slide. All right. Rebecca, do you want to give us a little, this is your opportunity to talk about the momentous, talk about that action that people can take?
Great. Yeah, absolutely. We're looking for sign-ons now. The momentous statement is an opportunity to call on anyone really, but we will use it, of course, with lawmakers to call for ambitious climate action that corrects for past injustices and centers resiliency and sort of bringing us back, bringing nature back, to a state that it once was. So restoration. So we really embed ambition, restoration, and justice into the core of the momentous statement. It is not in support of any specific policy, but rather a call to action in general. So we hope that you'll sign on and use this as a platform for your own advocacy actions, whether that's personal in your own life, whether that might be with a professional association or your congregation, or with lawmakers. I think we hope that you can use it as a platform for climate action.
Great, wonderful. Next, I wanted to let you know about some resources that are available on the Interfaith Partners for the Chesapeake website. These are two handouts that we have that talks about what is environmental justice. We talked about raising awareness. A lot of people don't even know what it is. So we put this together with Rebecca and some other organizations, and then the moral case for environmental justice, which is something that can really helpful if you're trying to persuade folks that maybe more of a conservative congregation as to why this is something that should fit within their social justice ministries. This is the first of our series of this environmental justice series. The next film that we'll be working on is the story of plastic. That panel discussion will be on Wednesday, February 10th at 7:30. That is a little bit longer of a movie. It's more of like an hour and a half, that movie. So you're going to want to watch that on your own. And the link will be made available on February 5th. That's being sponsored by our friends at St. John the Evangelist Roman Catholic Church. And that registration is on the Interfaith Partners for the Chesapeake website as well. Talking about advocacy, we will have an interfaith legislative briefing on January 31st at 2 o'clock. 2 o'clock. And that will be going over 5 legislative issues that are being brought up in this Maryland legislative session. So we'll be discussing the Coal Community Transition Act, the Climate Solutions Now Act, Transit Equity Recovery Package, the Plastic Bag Reduction Act, and the Environmental Human Rights Amendment. So join us for that to talk about, to learn about how to advocate for those issues. How we work at Interfaith Partners for the Chesapeake is by building green teams at communities of faith. We have a green team training that begins on February 11th. We welcome anyone to come. If you don't have a team already, you can come as an individual and we'll work with you and try to help you to build a team at your congregation. And I'm hoping to bring one from Columbia Jewish Congregation and the OMI congregations. That's what started all of this tonight. So hopefully we'll be doing that then. So we welcome you to join us there. Then we have a pledge also, the Interfaith Partners for the Chesapeake, a pledge for congregations to sign to care for the earth. And we would help welcome you there. So I do want to wrap us up and try to get us so that we're closed on time. To bring us back to the conversation. So today we're winding down the day of the Martin Luther King Day of Service. And as it comes to an end, I'd like to call upon the words from another great leader and ally to Dr. King, who is Rabbi Abraham Joshua Heschel. And he said, "Please demand of religious leaders personal involvement, not just solemn declaration. Ask of religious leaders to call for national repentance and personal sacrifice. The hour calls for moral grandeur and spiritual audacity." So what can we do to continue to honor Martin Luther King Jr.'s legacy? It will take all of us working together every day, every week, and every year to attempt to bring about the social and environmental justice we all deserve, to restore a wholeness to the web of life. We are truly all tied together in a single garment of destiny by the air we breathe, the water we drink, and the ground on which we live. There is a Jewish ethic from the Mishnah that says, the world stands on three things: Torah, service, and acts of loving kindness. And you are not obligated to complete the work, but neither are you free to desist from it. Let us all commit to working together as we try to move forward. And so I want to thank our speakers tonight, Rebecca, Dr. Kindred, Willie, thank you so much for your time to prepare, not just to be here, but also to get ready for this evening. Really appreciate that. Thank you to our tech gurus in the back, Robin and Lalani. Really, we couldn't have done this without your effort and help in all the registrations, and to all our participants. Thank you. We can stay on a few more minutes to answer any last questions that we didn't get to. If anything's burning, I can check in the chat box. But otherwise, I think everyone has my email address. I'm happy to follow up with you after this to get you all connected to resources and to move to action so that we can all work together.
There's a question for Dr. Kindred.
Yes.
In the Q&A.
Hold on, I have to find it. Let's see if I stop sharing.
It says I can, there we
Could
go.
speak to any dermatological problems associated with pollution. There's not a lot of research in it, so it'll be a quick answer. One, we find that it can aggravate eczema. So we like to separate seasonal allergies and separate asthma, separate eczema. It's actually all on the same spectrum. So on my end, a patient can be doing the perfectly correct thing for their eczema, but if their asthma or if their seasonal allergies act up, 2 weeks later, they have a flare of eczema. The reason why that's a problem is that eczema is the skin telling us the amount of inflammation happening inside of the body. There's a study of pregnant women where they had the women just walk around, do their normal daily activities, work in school, and they had backpacks that measured air pollution. And they found that the women with higher exposure to air pollution, actually, the babies actually had some kind of consequence, and we're seeing an increase in food allergies when it comes to skin, leads to eczema again. So far, most of the studies are just, the few studies are just on eczema.
Thank you. There is another question. It says air quality in especially Baltimore City schools and housing in terms of HVAC and Baltimore City and county indoor pollution. I think attention needs to be drawn to other factors besides carbon monoxide in homes in terms of the impact of indoor air quality on health and water quality. Buildings regulations, sickness from the environment, and accountability. Can you share your thoughts on this?
I go back to the same thing. All of these old buildings have asbestos in them, and if you don't have them tested, apparently it's a very expensive test, and it's very expensive to remediate them. But if you don't do it, your child is going to be sick. Same thing with mold in buildings. I think one of our Board of Education members sounded the alarm several years ago about mold in Western Howard County. And it's something easy to do the test. And it's just about some advocacy from families and communities to get to the bottom of it and to clear it up. There's nothing wrong with that. I mean, you don't want anybody to be sick. So I don't think it's hard to ask to do the test and then resolve the issue as quickly as possible, regardless of the expense.
Yeah, couldn't agree more. And I think, a lot of the major laws that regulate air pollution are for outside. And, that's great. But we spend 85 and 90%, maybe not Willie, he runs 20 miles to work. I got new goals this year. But for those of us that spend 85 to 90% of our time inside, we really do need better standards for indoor air quality. And I think that's a key point, and particularly in schools. And I think the groups like the Children's Environmental Health Network have healthy school, they have green school. There's a Green Schools Network. Children's Environmental Health Network has I'm totally blanking on their schools initiative, but what it's called, but they have this checklist and you can go through and make sure, kind of look around the classroom and see what's going on. And, to Willie's point, it's check it out, see what's happening. And then, you don't have to regulate first. You got to figure out from the community side what's going on first. And then, there might be some less expensive, low-hanging fruit solutions that you can implement, rather than immediately switching. I got to advocate for a law change. It's not always about changing the law. It's about, doing what you can with what you have. And I think a lot of those discussions on air filters for schools in particular are being discussed right now with COVID funding, because there's in these relief packages, there's a lot about, air filters and can we have better air filters to stop the spread? Well, let's multi-solve. If you're going to give me a giant grant to prevent COVID, let's think about that more holistically. And can we use it to do something that's going to address the impacts of climate change as well? And so there's a lot of good thinking around the COVID relief packages and the stimulus money to put in place solutions that directly address COVID, but actually also are good for our climate, are good for our kids, are good. It's this concept of multi-solving. And so I think that's just one thing I'll add about air filters in particular in schools. Use that COVID money wisely. That $1.9 trillion that's coming. Let's think about ways to get some environmental justice solutions out of the COVID funding, because clearly the disparities are there. It's well documented. So
great.
I think Hopkins is doing a study on Baltimore City. It's a 4-year project. So it'll be really important to see what their data shows.
Great. We have another comment. I just wanted to bring it up because it kind of cues up the next in our series. Marianne mentions that the Baltimore City just passed legislation to charge 5 cents for every plastic bag to encourage us all to use reusable bags. We have the same similar legislation in Howard County to reduce single-use plastic bags in Howard County. Of course, that legislation went into effect right when COVID hit, when everyone wouldn't let us bring our reusable bags into grocery stores, but things are letting up on that right now. Baltimore City did put a hold on their ban for a little while because of the pandemic. But join us for to watch the story of plastic to understand just about how that has come to be, and we'll have some solutions regarding that as well. So please come back again and join us again. So we appreciate it. Thanks everyone so much. We'll say good night. All right, thank you.
Thank you.
Thank you.